Hi, my name is Tori McCullough, and the topic that I chose to write my final paper on was social anxiety. And I chose this topic because I feel like it's something that a lot of people around the world struggle with. So, social anxiety is the fear of engaging in social situations due to fear of embarrassment. And some of the causes, it can come from genes. It's a type of disorder that can run in a family. So, like if your mom, sister, brother, or uncle has it, it's a chance that you can have it, and it can be inherited by your kids. But aside from genetics, it's also an environmental thing, like parenting, for example. Like at a young age, kids are very impressionable and they tend to mirror what their parents do. So if like their parents are always anxious around them all the time, that's what they'll do when they're older because that's what they've seen and known all of their childhood. And it's kind of similar to overprotective parenting as well, because being overprotective and sheltering your kids makes them more scared of the real world in a sense. And in the real world, you have to go out and talk and be sociable. But because they weren't allowed that freedom as a child to do so, it can be anxiety inducing for them when they're older because they have no experience with it. But another environmental thing with it is childhood trauma. Like bullying, for example, is a source of trauma. It's an embarrassing thing that usually happens in public, and it could be potentially embarrassing enough to stop one from going out in public at all because it basically scarred them. So some of the symptoms, it's a lot of symptoms for it to be able to see what it is, but and symptoms include blush, sweat, tremble, rapid heartbeat, having a blank mind, feeling sick to your stomach, feeling self-conscious that people will judge you, avoiding places where there's people, rigid body posture, find it hard to be around people you don't know. And then you can experience some of these symptoms and not have social anxiety disorder. So it's very important to actually speak with a professional before trying to make a self-diagnosis. And then treatment options include exposure therapy, in which you work through different social situations that you fear. And there's medications like SSRIs and SNRIs, and then like anti-anxiety medications. So what you really just have to figure out what works best for you, because everything just works differently for different types of people. And I chose to write about this topic because personally I feel like I struggle with it a little bit. Like going out in public and being in social situations, it kind of makes me nervous. Like I get nervous to talk to especially new people because I don't know how they're going to react to me or what they're going to think. So I just feel like this is something that kind of affects me. But yeah, I really enjoy researching this because I feel like it's not talked about a lot and it needs to be discussed more so people can be more informed about it. Thank you.